Shanna, I am so glad that you and I have actually finally had the time to sit down and talk to each other.
I know we've been talking about this forever. So for us to finally actually get to do this and have an opportunity to be here.
No, I'm so excited. Yeah. I'm so excited. And thank you so much. I know you caught a red eye.
I did. Tired.
You're running on steam. But today I really wanted to kind of capture us talking about the ever-changing aesthetic landscape and a lot of the questions that we come across that I really felt was important for me to ask you.
Okay.
Because you are at the forefront of everything. You are training day in and day out. You work with literally, you're not only an incredible provider, but you work with the best of the best.
Yeah.
And you're literally cross country day after day.
Yeah.
And so just thank you so much.
You're so welcome. And I'm glad we're finally going to get to talk about all the questions that we get all the time.
All the time.
And so that, people can have access to this information.
Yes. And thank you so much to Richard Maloof, who
this place
has
is amazing.
Given us the opportunity to host us here. His podcast, Man vs. 50, is a great podcast. My husband is a subscriber. I've been telling everyone about it, and it's truly entertaining, informative. Him and I had a podcast on PRF and hair regrowth.
Awesome.
So that one was super exciting. And on that note, I wanted to kind of start off the questions. I think there's about 10 very important questions that I want to ask you.
Okay.
And the first one is about regenerative aesthetics. Regenerative aesthetics, it's kind of a hot topic, right? Especially in aesthetics right now. Everyone is kind of moving towards the all natural.
Yeah.
And I wanted to ask you, what is your definition of regenerative aesthetics? What's your approach?
Yeah, I think people have different definitions of regenerative. For a lot of people, it goes to polylactic acid, like the PLLA. It can be exosomes. It can be PDGF. There's a lot of different definitions of it. And, I practice in San Francisco. I feel like it's very granola out there. So everybody likes regenerative. I'm a little sad because being a filler trainer myself, I think people are really kind of anti-filler right now. And that's just misinformation because filler can also be regenerative. Yeah. So there's lots of things that can help you regenerate. And that's also taking supplements, making sure you're taking good vitamins, making sure you're not destroying what your body is creating every day. So, and we all are destroying naturally. We're all blessed to age. So we've always got to do something to kind of keep up with it. So all of it can be regenerative, from exercising to good supplements, skincare, all of it. Some of the regenerative things that I think of is what can help me make collagen? What makes me have that natural glow? So there's lots of different products out there that can kind of help with that.
Yeah. Do you have a certain combination, a go-to combination when you're looking at a patient and you're assessing them and you see that, obviously they are starting to age and you're looking at them and you're like, okay,
yeah,
what am I?
Gosh, that's a whole nother podcast because honestly, you have to look at doing a proper consultation. That's something that I focus a lot on whenever I am doing a training. Yeah. I can have a brand new injector or I can have a very experienced, savvy injector. And if you don't know how to do a proper consultation, you're not going to be able to identify what the patient needs.
Yeah.
And that comes with, and everybody who's trained with me knows, I talk about the foundation all the time. You have a poor foundation, everything else means nothing. This building that we're in right now, the floor has to be laid, the concrete, before we ever put up walls, decorations, lights. So I think about our house kind of like the framing. And so, yeah, proper consultation. But then there are go-tos. So I'll just give you a quick, what if somebody came in, they have temple hollow, they have a weak jawline, and then I look and then they have crepey skin, hyperpigmentation, sunken in eyes. So my brain is tick, 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 all of it. Well, everything starts off with a neuromodulator, whether you're using Botox, Dysport, there's a million different ones, new ones coming out all the time. Then I look at a high G prime product, like an HA that you can lay down at the basement, the foundation. Now I start creeping up. Okay, does this person need soft tissue regeneration, such as like deep and superficial fat pads? Are we looking at building more collagen in that area? So I might be looking at like a PRF or a PRF gel, or maybe a polylactic or a type of Sculptra, that's the name brand here in the United States, type of product. And then I'm going to go even one step up. I'm going to go look at microneedling. Then I'm going to go one more.
Yeah.
I'm going to look at skincare, and then going back in. If you need mental health, I'm going to send you to a therapist. I'm going to, making sure you're taking care of your body from the inside.
Yeah.
So it's multi-layer, and I do that in all my for every single patient.
Yeah, I agree 100%. Like, I feel like aesthetics is kind of taking a more holistic approach.
Totally.
Where it is total body.
Yeah.
And I love it because I feel like we've opened up the doorway to a broader patient population.
Totally.
Right?
But even surgery, think about surgery.
Yeah.
Plastic surgery, back in the day, people had windblown face. They're tight. They look strange, right? And it got a really bad rap. And then you look at them, you think, oh, they're going to look amazing. No. You know why? Because the skin quality was crap.
Right.
They still had hyperpigmentation.
They weren't addressing it.
They weren't addressing all of it, right? And then you have body dysmorphia and a whole nother range of things going on.
I agree.
You know?
No,
So it is always changing. And I'm glad it's becoming more encompassing.
Yes. And I love that it is shifting.
Yeah.
I really think that, you can just see it in Hollywood, like the way everyone looks, it's just so much better.
Yeah.
Okay, well, that's great. Now I have another question for you. It's kind of shifting gears, but still going in with regenerative aesthetics. Some providers seem hesitant to incorporate PDO threads.
Oh, yeah.
So polydioxanone threads.
I probably touched on it a little bit, but yeah, PDO threads.
And in your experience, why do you think there's hesitation, and how can that mindset be shifted? Because I've seen incredible results with PDO threads, and I'm always preaching, the benefits of it. And so I wanted to get your thoughts.
I'm guilty of it, and I'll tell you why. Back in 2014, 2015, when Dr. Keon Creamy and Nova Threads was the thread company, they wanted me to be a trainer for them, like learn about it. And I'm like, yeah, no, thanks. I'm so not interested in threads because they had such a bad reputation of the old days, the non-absorbable sutures. So what I'm trying to get to is it's about educating yourself.
Yeah.
You need to understand what PDO threads can do. As a trainer for PDO threads, I use in my practice Nova Threads. I love when I train on it, I'm not going to cause blindness. I'm not going to cause tissue necrosis.
So safe.
Of course, there's going to be complications, and there is a huge learning curve. You don't take the class once or a training once and think you're an expert. None of us should. I still don't think of myself as an expert in a lot of different areas.
It does have a learning curve.
Huge learning curve.
Absolutely.
And if you don't keep doing trainings, I forget who used to say, they used to say, if you're not learning, you're not growing.
Yeah.
You don't ever want to be stagnant. And so for me, I train some of the same providers over and over again because they're like, oh yeah, I love that. And I've got an idea for this. PDO threads are safe. You've got to know how to do them. You've got to know how to take care of complications. And it's one of those things that you actually have to have hands-on training for. But I think it's great as a collagen stimulator. It makes type 1 collagen, and there's longevity in it. And we have tons of studies to back that up.
Yeah, and actually that leads me into my next question for you is kind of talk about the regenerative aspects of a PDO, a polydioxanone thread. Like, what is it? How does it work inside our body?
Totally. So basically, we use it the most in like GYN surgery, cardiac surgery. We use it in plastic surgery. And what we love about it is it's 100% absorbable. The thread goes away and you get left behind this type 1 collagen. Depending on which size threads, how many threads you put in, what place you're putting it, there's a lot of different factors, but the generic answer is at about 6 or 7 weeks for one of those little bitty tiny threads, like a small 5/0 or 6/0 suture, you're making type 1 collagen. You see 20 times more than what you started off with.
Yeah.
That's huge. That's a big number. If you don't do another treatment and you just kind of let it sit out, at even 6 months, you still have twice as much collagen than what you started. It's pretty nice. But the key here is continuing your care.
Yes.
You don't get to just do one and done.
Right. And it's with all different types
All
of treatments,
modalities,
right?
It doesn't matter what
And,
you're doing. You don't get to do a neuromodulator once to get rid of your 11s, and then you're like, I'm good for the rest of my life.
Yeah.
I even go dentist. You don't get your teeth cleaned once.
No, that's
for the
so
rest of your
true.
life.
Exactly.
You got to do something.
Exactly.
Yeah.
You have to maintain it.
We're blessed to age. That's what I keep trying to tell people. You are blessed to age. Let's make sure we age gracefully.
Yeah. And PDO threads, like, I listen to you talk to providers about it. You're creating that scaffolding.
Mm-hmm.
And so, like you said earlier, there's different threads that do different things. So you've got like your, more robust lifting threads.
That's right.
But then you've got the small collagen building threads.
And the other thing that I think is also important is you don't have to do a full face of all threads. Everybody thinks that, I'm getting like mega sessions and they cost $5,000 to $10,000 and they only last like a year or whatever, which isn't true either. What I tell people is this combination.
Yeah.
If I'm looking at somebody's profile, and I think that's one of our questions we're going to talk about, right? Do we talk about combination treatment?
Yes.
And one of the combination treatments is incorporating an HA filler if somebody has a weak chin or a weak jawline. You can lift them with threads here, but if they don't have a nice jawline, you can lift them to the cows come home. They're not going to ever have that, I hate this word, snatch jawline, right? Because they have a weak chin.
Right.
Or they have, other things going on. So you got to address the whole face.
Yeah, that full facial balancing.
Yeah. Mm-hmm.
No, I agree 100%. Do you believe, now still kind of discussing PDO threads, do you believe there's any legitimate reason why providers feel intimidated by threads? Or is it more a matter of kind of what you were saying, education and exposure?
I think it's education and exposure. And unfortunately, social media is part of our life. Not a huge fan of that, obviously. I'm trying to be more embracing because I think there's so much good out of social media.
It is important.
Great podcasts. You have great things that you can look at. But people keep listening to the negative noise, and I don't like that. You've got to really do your own research. One of our medical directors, he's a facial plastic. He does facelifts. He has no problems doing a facelift after a PDO thread. He has no problems doing a facelift after polylactic acid, like the Sculptra type things. No problems. Educate yourself. Don't listen to one person who says, threads are bad. Really use it in your own hands. I would never endorse anything that does not have patient safety as my guide. That is my forefront. I always want to make sure I use products that are safe.
No, definitely.
Yeah. But I think that's the big one. They want to listen. And listen, we saw a huge jump in threads, and then it took a nosedive, and now I'm seeing it back again.
It's coming back. Yeah. I think it's coming back because they're realizing not only its safety, but its efficacy.
Yeah.
And what I always tell providers is it's an incredible tool to have in your toolbox.
Totally. Yeah, you need more than just a spoon to eat.
Exactly.
You need lots of different things. Yeah.
You need a combination approach.
Combination treatments is the way to go for pretty much everything. Okay. And if you're just bringing a patient in to do Botox, I don't own my own business, but just hearing enough talk during that 15, 30-minute appointment, you should be generating more of a ROI than just that 15-minute appointment. I do 30-minute Botox appointments or neuromodulator appointments because if somebody is like, Shanna, I remember you telling me I should do a couple of threads, or I remember you said that my chin looks weak. Can we do it? Sure, I'll add it on. I can do that in that 30-minute time frame, So for me, I think that it's important that the patients want it too, by the way. Right. You want to maximize that time that you have with them.
Exactly. And you'll see things that, can be beneficial for them that are an easy add-on.
Add-on, yep. Mm-hmm.
So
little smooths for crow's feet. My favorite is people are like, Shanna, look at the Botox that work on my crow's feet, and they're smiling their biggest, cheesiest smile, and they have vertical rhytids. And I said, well, I didn't Botox your cheek. Yeah. I did your crow's feet.
Yeah.
But those lines we need to strengthen your skin. So I have products that I can talk about.
Yeah.
Smooths, Skin Vive, which is a hyaluronic acid that you put intradermal. I can do microneedling. I can get you on a retinol. Let's make sure you're doing sunscreen. Yeah. I'm going to address all that.
Yep. No, so important. Okay. So my other question for you is, in your opinion, what makes someone an ideal aesthetic patient? not just physically, but in mindset and expectations.
Okay, so this is where I get kind of naughty. Well, first of all, I'm very upfront with my patients. I don't date hoes. Okay, I know that sounds funky, but I'm just telling you, and we've all had those patients that go from one person, then they go to another person, and then they go to another person. Right. That is a hoe. We are still doing medical procedures. I need continuity of care.
Yeah.
So I tell my patients, if they're new to me, most of my patients are loyal. So I tell them I expect loyalty. And if you're not, I'll fire you. And you're not coming back into my chair. I've fired people for being like that. Now, if it's something like I had to refer them out, that's different, right? But honestly, like, I want loyal patients. When people don't take what we're doing serious, because we are healthcare providers, we need to take this serious.
Yeah.
Because there's a lot of, I have so many friends who have diagnosed melanoma. You know, they've seen other things metabolically that have like changed, like they're like something's amiss here. And that all came from coming in for your neuromodulator, your Botox, or your filler.
Yeah.
So we take this very serious, and I take care of you. And I expect you to be loyal to me because it helps us create a very healthy care plan for you. So a good patient is somebody who's going to be loyal to you, right? And they're going to stick with you because you've come up with a care plan for them. And they understand
definitely.
it.
Yes. Yeah. And if they're hopping around, you don't know what they've done somewhere else. And then all of a sudden, you know, they have an irregularity or a complication and you're just kind of scratching your head.
And they're not blaming the person that caused it. They're blaming you because you're the last one that touched them.
Right.
And that's why my, sarcastic hoe analogy comes from. Like, you sleep with one person. You didn't just sleep with that person. You slept with the person before them and the person before them. It's the same idea.
Yeah.
If I touch somebody who's been to 5 different, first of all, that already tells me red flag on this patient. Maybe I don't want them as a patient. Yeah. And I will tell my patients, I'm not the provider for you, and I'll refer you to my worst enemy. No, I'm kidding. I won't. No, but I will generally say I'm not we're probably not a match because what you see and what I see aren't the same. Yeah.
So here's a question that I actually just thought of, but I think it's an important question with what we were talking about, going along with like patient expectation and PDO threads. Yeah. I think this is an important question to address because, patient expectation is so important. How do you prep the patient? How do you consult the patient for them to understand the process of maybe PDO thread lifting or...
So I think it goes back to the consultation, like you had alluded to, like setting up the expectation starts with the first time you actually talk to the patient. I lay out everything for them. I assess them from forehead to clavicle, and we talk about everything that I can do for them. If they're walking in going, this is what I want, Shanna, and I'm like, that's not realistic. You need surgery if you want something like that. I can't do that with thread. So I'm already setting up realistic expectation right off the bat by saying that's not going to happen. Then after doing the full assessment, and then I tell them, listen, just because I do threads on you once with some chin filler, does that mean
it's a process?
It's a process. And the way I package mine, I might do a lifting thread, but I always use the tiny little threads. I call it my wall of collagen to give them support. And I expect to see you back in 6 weeks. Yeah. So they're never allowed to leave my practice without another appointment.
So smart.
And that way I could add more because, again, without consistency, you're not going to have success.
Yeah.
Period.
No, I agree. And thank you for answering that.
Yeah.
Okay, so my next question for you is, what role does patient education, and this is kind of talking about everything we've been talking about, but what role does patient education play in the success of regenerative treatments? Yeah. And how do you approach that conversation?
Right. I think it's kind of interesting because there are so many different regenerative things out there, whether you're talking about exosome, PDGF, PRF.
Well, I feel like they don't know what everything is.
They're
like, wait, it's so many acronyms like
There's
PRF, PDO,
platelet-rich,
PDGF.
Yeah, platelet-rich fibrin, very good. Platelet-rich fibrin that I put into a gel that's a carrier, so you get a slow release of your growth factors.
Yeah.
Then there's something called platelet-derived growth factors that comes from a source. And then you can microneedle that in. That's the FDA approval. There's AreaSense is one of the companies. Then you have I feel like there's so many exosomes that are coming out right now. And a majority of them are coming over from Korea, my motherland, right? But you've got to ask, where is the source? Know where the source is from. Is that something you're going to like? I always joke. I always say, I have enough Korean fat. I don't want somebody else's. It's a joke. There's not theoretically genetic material in there. But when I use my own PRF growth factors, the source is me.
Yeah.
My body likes me.
Yeah.
I'm good, right? So I feel like when I've had it done, microneedling, injected, I do pretty good. But yeah, there's so many different ones. So I always tell people, find out where the source is. How is it processed? Where is it processed? If you ask those questions, you'll find what's the right product for you.
Right.
Yeah.
Definitely.
Yeah. So it's about giving them that information.
Yeah. And not all brands are created equal. I know Nova Threads just came out with Exo Next, a little bit less than a year ago. And it's had incredible results.
Great results. I've used it on my family. They love it. And there's a plant derivative in there. And a lot of people are like, well, last I look, I wasn't a plant.
Yeah.
It's not for you. That's for calming your skin down.
It's
anti-inflammatory. It's an anti-inflammatory. So everything you do doesn't have to be like a human source or something like that. But understanding why certain additives are added into an exosome is very helpful to understand. I tell people, take ownership, like research it, figure it out. We'll give you the information. There's pamphlets. I have all kinds of pamphlets for everything that we offer in my practice. Yeah. But take ownership of it. Don't just trust blindly. That's the other thing.
Yes.
Yeah.
So my other question for you is, what advice would you give to a provider who wants to start integrating regenerative modalities, but feels overwhelmed by the options or the techniques?
Yeah. I say try to go to as many dinner talks, try to go to as many trainings, go to workshops that conferences are holding.
Yes.
I think you need to gather up information. It can be overwhelming. Find an amazing rep or business development manager. Nicole, I'm putting you on the spot. You're one of the best. And honestly, when I hear people talk about you, they're like, you're always there for me. You always get information. You get back to me. If people aren't doing those things, that's a red flag. Okay. So from a rep perspective too. So I know I have some of the best reps. My rep in my BDM, I hate calling her a rep. She's my business development manager, Ashley and Lisa Benjamin. I have some great people who I wouldn't be here without them because they have supported me, helped me with problems and issues or whatever. That's what you want to look for. So yeah, it's a lot of information. Get the information, build a great relationship. And that's the other thing I do in part of my consultation. I tell people we're in a long-term relationship, like a marriage, no divorces, no one-night stands. Like you're mine forever. And I have that relationship with my reps and my BDMs and the people who are giving me information. And then it's on me to do the research. So it can be overwhelming as an injector who's coming in and trying to understand like everything there, but use your reps gently, nicely. But they're there to help you grow and understand it. Take advantage of all the classes.
Yeah, I always tell them, I'm like...
Trainings.
Yes. Oh, definitely. Never stop learning. And as a support network, the companies that I work with, Cosmo France, Nova Threads, Rajani MD, Heal MD, they have me from here now to the end. Like I want to make sure that they're successful and that they have the tools they need to be successful.
Totally.
Whether it's taking an advanced training or coming in and doing a practice day.
That's something that you do that I love. And only a few reps do this. And I love it because I think it makes a huge difference in a practice. If I come in there and train you, you'll go back in there a week or two later to do a follow-up patient, a follow-up training, or at least do a Zoom with them or whatever. And then I make sure everybody is in touch with me. They have my card. They can call me. I still have people who text me from when I did a training in 2010. And I will still answer them and help them. And that's what you want, that community where you have an amazing rep or a BDM that's going to help you. I think that's really important.
No, I think it makes the accounts very successful.
Yeah.
And it makes them confident in using the modalities that we've been talking about because they not only fully understand them, they've been practicing with them, and they're really getting great outcomes.
Yeah. Yeah. Really great outcomes. Yeah.
But so I have one last question for
Okay.
you. It's a quick question.
Okay.
What are your top conferences that you would
Okay, so and
want
I'll put a
to-
disclaimer on there because I'm typically a speaker at these conferences, but I speak at them because I believe in them. Number one, LAMCA. Dr. Keon
Amazing
Creamy
conference.
does a very small, intimate with a lot of people doing, not the people going to it don't do the hands-on, but you watch people do it. I think it's one of the most innovative conferences that I get to speak at. As a healthcare provider, as a nurse, my other one that's equal is ISPAN, International Society of Plastic and Aesthetic Nurses, ispan.org. Again, an amazing conference. It has grown so much. I mean, back from when I first started, that's also where you can sit for this to be certified aesthetic nurse specialist. It's a nationally recognized extra testing that you do to show that you actually understand the processes of what goes into being an aesthetic nurse. The other one that, one that I really like, I like TAS. I like it's changed. It's gone up and down. I used to do VCS. I like TAS. I like them all. The other one that I think is really important for med spa owners is AmSpa. Being a member of AmSpa, and their conference is actually going on right now, I think, the first couple weeks of April. I also do this really small one that I love in Miami. It's called IAFA. It used to be geared to just dentists, but it has grown huge. So it's one of my favorite conferences. This year it's going to be, I forget, but it's in Miami. It's in November. So usually LAMCA is in March. We have ISPAN, which correlates with the plastic surgery meeting. This year it's in Fort Lauderdale, and it moves all the time. But LAMCA is always at the Four Seasons in Beverly Hills. And then the one in Miami, IAFA is always down in Miami. TAS, VCS is always in Vegas, and I think AmSpa is always there. There's a couple of other ones that I have yet to go to, but it's on my bucket list. It's Modern Con, I think it's something like that. And then looking at going to the Aesthetic Extender one that's in Palm Beach. But
nice.
if I were to summarize,
I know there's a lot of them.
There's a lot of them.
That's why I wanted to ask you, because
ISPAN for sure. That's a must. Business owner, AmSpa, and IFA. It's a little bit different. It's a Fun 5 in Miami.
Yeah.
So those, and then I will be speaking at one that Wendy Pickett does in March next year, beginning of March, and I want to say it's AICC. Don't quote me on that, but it's brand new. So it's
that's
inaugural
exciting.
season. So it's going to be the first year. So
That's
I'm so
wonderful.
blessed to be a part of that.
Oh, well,
Yeah.
thank you so much
Thank you.
for taking the time to
Well, I hope this was
sit down.
helpful, and
Oh
I'm
my
glad we
gosh.
finally got to do it.
Yes,
Yeah.
it was super helpful.
Yeah.
I think that, and I hope that we do it again.
Yes.
We have more, you
We've
have
talked
so
about
much
the fun
information.
ones. We've called car chat. We've tried it,
Yeah.
and we die laughing because the filters are horrible and the sound's terrible. But yeah, we should totally do this again.
No. And
Yeah.
thank you so much, Richard, for hosting us.
thank you,
This
Richard.
is an incredible opportunity.
Yeah. So thank you for sharing your space. We're
Yeah.
very grateful.
Yeah.
Thanks,
And-
Nicole.
Yeah.